Hello and welcome to Ask the Oncologist. Today I'll be taking you through how cancer is diagnosed. A lot of people fear the word biopsy, and I've had a lot of my patients who would rather go through anything than have a biopsy done. Now I'll be taking you through the steps of how cancer is diagnosed, and I will talk about what a biopsy is. Now, what happens when you present to the hospital with your symptoms? If you present to the hospital with that lump in the breast, with that persistent abdominal pain, with that swelling that you've noticed somewhere at the back of your hand, with that pain, with a swelling, or with that fracture that looks abnormal that you have in your lower limb, what happens? What are you likely to go through? Now, one of the first things that we do when you come to the hospital is we take a history. So with a history, your doctor will want to know when you notice that particular sign or symptom that you presented with. We will want to know how you noticed it. For example, if it's a lump, we want to know how fast it has been growing, whether there is pain associated with it, whether there are any swellings or something we call lymph nodes in other parts of your body, for example, in the armpit, in the groin, or somewhere on the abdominal wall. We would like to know this thing. We will ask you about all of this. Most of the time, we also want to know whether you have any risk factors that may make it likely that what you are noticing is a cancer or not. After the history, what happens? We do a clinical examination. In the examination, your doctor will want to have a look at that part of the body and a general examination of all of your body to better understand the symptom that you presented with, to be able to actually assess that swelling or that area that you have pain, and to be able to have a lot more information and determine the likelihood of this being a serious problem or otherwise. Now, after the physical examination, you will be asked to go through some investigations. This may be a CT scan, it may be a chest x-ray, it may even require sometimes an MRI or a PET-CT scan. So this laboratory information helps us to understand. You know, when we do a physical examination, we only see what is outside the body. But this clinical imaging or this lab test help us to be able to know the extent of whatever you have noticed in the body. It helps us to know whether there is any movement of some of the cells in the region that you have noticed to any other part of the body. So you may go through any form of such imaging. You may also do something we call tumor markers depending on what we are suspecting. And then we come to what we call a biopsy. A biopsy is when your doctor requests that a little bit of the tissues from that particular swelling, from that tumor that you are concerned about, a little bit of tissues from that is taken out and sent to the pathologist to conduct an examination on it. Now, if you watch my previous video, I did talk about the fact that tumors can be benign or malignant. So how do we know? How do we know that that swelling that you are concerned about is either a cancer or not? The only way to be able to tell is to take a bit of it and take it to the pathologist to examine it. That is the surest way to be able to tell that whatever you are noticing, whether it's a cancer or it is not a cancer. So how is a biopsy done? There are different types of biopsies. There are times where a very tiny needle can just be used to take some tissue, very small amount of tissue, just like an injection from that side of the body that you are concerned about. And then we also have true cut biopsy, where we use a needle that is slightly bigger, that is used to take very tiny pieces or strands of tissue from the swelling that you are concerned about, and it's taken to the pathologist for examination. We also have a biopsy where your doctor will take a bigger chunk of tissue, why we call it an excision biopsy. A bigger chunk of tissue is taken and sent to the pathologist for examination. But I want you to understand that a biopsy is very essential for us to be able to arrive at a diagnosis and to be able to prescribe the right treatment that you require for that diagnosis. Now, always remember that early diagnosis of cancer saves lives. So be on the lookout and report any unusual symptom that you may notice to your healthcare provider. Thank you very much for making time, and then see you in our next video. Don't forget to subscribe to the channel so that you don't miss any of our educative content. Thank you. See you.